The real point of this is that excellence is appreciated by the consumer at the end of the day. And I think in healthcare we need to be cognizant of that as well. Aristotle had a great quote that I think is very applicable to healthcare, and we talk about this at Southlake on a daily basis. Excellence is what we repeatedly do, so it's not an act, but it's a habit. And in the space program, we really commit to making sure that everything we do, we're doing it with attention on excellence. So creating that daily focus in the personal commitment to excellence is really critical. So I would argue that we're going from the era of evidence-based medicine, which is a subject of your vocabulary on a day-to-day basis, to the era of quality-based medicine. And I think in quality-based medicine, it's a little bit different than evidence-based medicine. The Institute of Medicine has actually come forward and it's got a definition of medical care, and this is their definition: degree to which health services for individuals, populations increase the likelihood of health outcomes consistent with current medical knowledge. To me, this is a definition that's written by healthcare professionals. You know, it's like in the previous video, a computer engineer giving you a description of a fantastic computer. I think what's interesting is to very simply look at evidence-based medicine tells us scientifically what we need to do. We're very good at that. But quality-based medicine tells us how to do that. And one of the things that we've been doing in the space program for the last 14, 15 years is taking clinical scientific evidence and modifying that to deliver individualized health care that meets the unique needs of a patient. And I'll give you an example of that. If we have a 45-year-old male astronaut who's flying in space in the space station, and we have a 55-year-old postmenopausal female astronaut flying on the International Space Station, it's obvious that we should not be giving them the same countermeasures to prevent bone loss or osteoporosis in space. It's intuitively obvious that the two should have totally different countermeasures that are unique to their specific physiology. So if we can understand that from the space environment, we can take the same concept and say, yes, scientific evidence gives us a guideline on what we should be doing, but the real quality in delivering excellent medical care comes from implementing that on an individual basis for the patients. Now, I don't know if any of you have had your own personal healthcare experience, but when you are a patient and you're lying on a stretcher like that, you kind of want to feel like you're a human being and the people are thinking about you and things. So from the healthcare provider's experience, they may look at this and say, phenomenally successful case, we've got a great result, patient's doing well. From the patient's perspective, they may feel that there's in fact something lacking, that human experience is lacking.